you have the six for the 6 districts, and we're going to talk about that too. But what is concern? Like, what was the concern that made you wanted to do something about health, environment, and education?
Yeah, and they all link together, which is nice. So health is where it begins, and uh, probably the most motivating factor for me running for public office was my experience with the brain tumor and surgery. And the brief version of that story is that I almost didn't get it checked out. So I had a blind spot growing in my eye. When I would read to my children, I could make like the pictures of the animals on the page disappear if I closed one eye, which is not a good thing
Yeah.
medically. But we had recently moved to a high deductible insurance plan at my employer. And so I'm like, I don't want to pay the money to go to a specialist. And until my wife went to a specialist and we got to the deductible for something else, I wasn't going to go. And then I was diagnosed, and I suddenly realized that the structure of the healthcare, well, it also cost us a lot of money, and we're still digging out of that debt, even with good insurance. And this is 5 years later. Particularly in lower income areas of the Commonwealth, the sort of game changer that truly affordable, non-employer sponsored healthcare could offer would be a major revitalization for lives, even more than economy. So what I came to realize that my belief is that the main reason we can't get away from employer-sponsored healthcare in the United States is because it's a way that large companies can keep people working for them instead of quitting. Because if you could quit your job and not worry about your health, I think a lot of people would quit bad jobs, or people would leave abusive partnerships. They would start their own companies. And so again, in a place, the household income in Crawford County, median income in like Meadville is like $26,000 a year, well below the state average. If they didn't, you can't afford healthcare on that. And so that is a game changer for us. Plus, we have a higher background incidence rate of cancer here than other parts of the Commonwealth because of the industrial path. So we've been poisoned. We can't afford the healthcare. And the kind of economic revitalization we get, this will link to the environment, is stuff that will make us sicker. So we need to recognize that the environment is a lot of who we are. Whether we're conservatives, enjoy hunting and fishing, or whether we're tree-hugging liberals, we like trees and water and air. It's good for us. Plus, there's an economic benefit that if we can focus on green development, we have jobs. We can build stuff. Our tool and die shops here can build parts for windmills as much as they can build parts for gas wells. And then education is that mechanism for transformation in lives. You know, I'm an educator. That's my career has been that. But we all understand that having access to public education lets people move forward in life. And that's every level, from pre-K through university, job training and retraining, vocations, technical school, all of that is so important for us. And then the other part I'll throw in the education, because we're in a conservative area, with right-wing representation, there's a big push for vouchers. And when you start thinking about that in a rural area, you realize how self-destructive that is. Because if we start taking more money out of our public school districts, there's nowhere for our children to go. It's not even like there's a private school for most of them to go to with the voucher. So all you're doing is pulling money out of the system for the wealthy elsewhere, and we get poorer. So those all start connecting, and it's our bodies and our lives that are on the line with all of this.